Hi friends, this is Dr. Abdequaem Chimthanawala. Today let us discuss some remedies for headache. Now I had a lot of queries, cases, tell something about headache. So I have decided to give you few remedies of headache, migraine. Not so commonly used because some commonly used medicine like natramur, belladonna, amyl nitrate. These remedies basically everybody knows like glonine. So I'll discuss some remedies which are very useful and that has given me good results in my day-to-day practice. Of course, the first remedy that comes to my mind is aconite napellus. Though aconite is used only for that one symptom of sudden and violent, it has one symptom of headache which is very, very peculiar, and if you ask the patient, give him time, he'll tell you this symptom very precisely. An aconite patient has burning this headache as if burning, as if the brain were agitated. मतलब ब्रेन को किसने सी चिड़चिड़ करा दी, इसको मतलब पोक किया ब्रेन को बाय बॉइलिंग वाटर. पेशेंट आके बोलता है कैसे लग रहा है कि मेरे सर से गर्म गर्म पानी उबल रहा है, इतना हेड हो रहा है, एज इफ माई हेड इज बॉइलिंग, एज इफ द बर्निंग इज सो मच दैट द ब्रेन इज एजिटेटेड बाय बॉइलिंग वाटर. ग्लोनाइन में क्या लगता है, उसको वेव्स के समान लगता है. दैट इज एकोनाइट नेपेलस. एंड सनस्ट्रोक फ्रॉम स्लीपिंग इन द रेज ऑफ द सन, that is a or sunstroke from going out in the sun, and better by copious urination. This is very important. Whenever the patient tells you मैं जब यूरिन पास करता हूँ मुझे बहुत अच्छा लगता है, of course you can take better by discharges and there are different remedies, but in aconite if you say better by copious urination, sunstroke by going in the rays of the sun, headache burning as if the brain were agitated by boiling water. Remember this word boiling water, and the patient will tell you this symptom if you take the case very calmly and very precisely. Give some time to the patient. Next remedy, again a very infrequently used remedy. I'll discuss something about Ethuza synapium. I'll be discussing only the 3 marking and the very important symptom of the remedies. Okay. Ethuza synapium has a very, very important symptom, that is there is violent pain in the brain as if it were dashed to pieces. पेशेंट बोलता है कैसे लगता है मुझे किसने मेरे सिर को ऐसी दीवार पे मारा दिया और पूरे टुकड़े हो गए उसके. The pain is so severe as if it is dashed to pieces. Now if the patient feels as if it is dashed to pieces, कैसा रहेगा modality? Better by fastening up. The patient has a desire to have a band fastened tightly around the head. ऐसे बैंड बांध लेता है पेशेंट, बोलते हैं ना बैंड जम से टाइट बांध रही, टाइट्स द बैंड हेड tightly on the head, so that sensation of dashed and throwing it to pieces is better and the headache is better. With this regard, you have to remember 2 remedies. Those are very, very important, and you have to differentiate these headaches. The first remedy is argentum nitricum and the second remedy is picric acid. Now these 3 remedies have a very, very similar modality. The patient has a desire to have a band fastened tightly on the head. This is Ethuza synapium. Again, third remedy, which is again sometimes infrequently used, that is Agaricus muscarius. That also has a very peculiar and a typical feature of headache, as if sharp ice touch the needles, as if उसको लगता है कि ऐसी आइस मतलब आइस की ऐसी किसने ऐसी टच किया हेड पे, या किसने नीडल हेड पे टच किया, as if sharp ice touched to the head or sharp needles pierced in the head. That is a headache. That is a sensation which the patient tell you of Agaricus muscarius. It has also nervous headache, from overwork at the desk. Especially you'll see government officers who are basically working on desk, or private job also, working too much on desk, working 10 hours, 12 hours in a day. They come home and they get severe headache, nervous headache from overwork. This is also a very important symptom of Agaricus muscarius. And in Agaricus muscarius, the patient, the head goes like this, because the patient feels so much heaviness in the occiput that he feels that his head will fall backward because the heaviness in the occiput. These are the very important and prescribing symptoms of remedy which I'm telling you. Of course, there are many of symptoms, but this is the unique characteristic of the remedy. Next remedy, again a very infrequently used remedy that will give you good result, that is Agnus castus. Of course, Agnus castus, if you have seen my previous YouTube videos, I have told you something about Agnus castus of sexual spheres and mind. Today I'll tell you something about headache. Contracting headaches. from sexual debility after sexual excess. This is the symptom of Agnus castus, contracting headache. And the modality of Agnus cast, if you get in that patient, there is no remedy which will work better like Agnus cast. That is ameliorated by looking at one point. Patient is dikhta rahega. If he is seeing the chair in front of you like this and he feels better, that is the Agnus cast modality, ameliorated by looking at one point. This is Agnus cast. Very, very important, very, very precise symptom of Agnus cast that you have to remember. Again, to make the video short, I'll just take one remedy before I close the video. Allium cepa. You know allium cepa related to rhinitis and allergic rhinitis and sneezing and watering from the eyes and nose, but headache. Headache ceases during menses. Patient precisely बोलेंगे, lady बोलेंगे, जब भी मेरा menses आता है मेरा headache ठीक हो जाता है, and returns after the cessation. Such a wonderful symptom of allium cepa. Headache ceases during menses and returns after cessation, and a sensation is there. Sensation as if the whole head were wrapped in hot clothes. Patient बोलता है ऐसे मुझे गर्म कपड़े से मेरा सिर किसने पूरा wrap कर दिया हो, बांध दिया हो. That is the allium cepa headache, my dear friends. Very, very precise and very, very interesting modalities which I have told you about allium cepa, Agnus cast, agaricus, ethosinopium, and aconite napellus. These rare remedies I am taking because they carry a very, very different symptom, different modality, and a peculiar modality that you have to look in your patients. So my dear friends, if you like this video, do share and subscribe. Thank you.